Hello, a warm welcome to CREST.BD's Bipolar Wellness Centre webinar series. This webinar will provide you with a summary of current research evidence on the relationship between sleep and quality of life, as well as pointing you to some tools and resources to help you optimally manage your sleep.
Hi, my name is Greg Murray. I'm a psychologist and an academic at Swinburne University in Australia, and I'm here to speak to you for a few minutes about the importance of sleep in quality of life in bipolar disorder. We've got about 20 minutes to talk, and I'm going to cover three major issues really quite briefly, and if you want more detail about any of these topics, you can find that on the sleep domain on the Wellness Centre. So there's three major points we want to make today. We're going to talk a bit about why sleep is important to your quality of life in bipolar disorder. We're going to talk about some strategies that you can employ to improve your sleep and introduce you to some tools and resources that will support those strategies. So let's start with why is sleep important to quality of life in bipolar disorder? Well, first, sleep is important to everyone, and there's been a huge amount of research over the last 20 or 30 years into what are the specific consequences of inadequate sleep. So this applies to everyone, whether you've got bipolar disorder or not. And the first thing that's very obvious, I think all of us know this, if we don't have adequate sleep, our mood changes. We tend to have more negative affect. We're more irritable. We might be more intolerant. But one of the things that we also notice, it's a bit more subtle perhaps, is if we don't get enough sleep, we also get decreased positive affect and motivation. That is, we might get a bit of the can't be bothered, you know, someone makes an offer, come and do this, and say, maybe not today. So we get an increase in negative affect, but we also get a decrease in positive affect. Then there's also some cognitive changes that go with not having adequate sleep. By the way, adequate sleep, it's different for everybody. The average amount of sleep that people consider adequate is around 8 hours. You've probably heard that figure. But it is quite different for different people. So it's worthwhile thinking for yourself about how many hours sleep you feel you need to feel refreshed in the morning. But if you're not getting adequate sleep for you, you will also start to see differences in cognition. So we see decreased planning and memory, what we call executive function, the ability to manage complex tasks, but also problems with simple concentration and attention. And that happens for everybody. But for people with bipolar disorder, it's particularly important because, for starters, changes in sleep can be a marker of the onset of an episode. So with depressive episodes, we almost always see alterations in sleep. That alteration in sleep can have two forms. We can have difficulty getting off to sleep, so maybe some insomnia, broken sleep, waking through the night, and also hypersomnia, that is wanting more and more sleep, and maybe sleeping during the day, finding it difficult to get out of bed. And with mania, you've probably heard this, or you may have experienced this, that when we're starting to get a bit hypomanic or a bit excited, we sometimes experience decreased need for sleep. So people with bipolar disorder, when they're a bit hypomanic, will say, I can just keep going. I'm involved in all these interesting tasks. I don't need to sleep. And so it's very important, sleep becomes important for quality of life in terms of monitoring how you're going in relation to episodes. But the final and one of the most important ways that sleep is important for quality of life in bipolar disorder, of course, is that changes in sleep can actually cause relapse. So you may have heard that lifestyles that challenge your sleep can be not so good for people with bipolar disorder. So certain professions like being a musician or working in bars, or things that affect your sleep, say through travel, time zone travel can cause relapse, or working shift work. So changes in sleep are actually potentially a trigger for relapse. So all in all, it's pretty obvious that sleep is important to quality of life in bipolar disorder, and there's no doubt that people with bipolar disorder do pay a lot of attention to their sleep, and for many people with bipolar disorder, it's a very major issue. So for the next few minutes, what we're going to talk about is how generally people can improve their sleep. And some of it is common sense, and some of it I'll have to put on my teacher's hat and do a bit of instruction. So just having a look at this figure, good sleep is a consequence of proper functioning in 3 areas, and I'm just very briefly going to describe these to you. The first one is intuitive. We sleep well, or we're primed to sleep when we've been awake for a long time. Yeah? So the longer I've been awake, the easier it is for me to fall asleep. This is called sleep drive. It's analogous to hunger. You know, the longer I haven't eaten, the more appealing food is to me. So that's the obvious one. One of the things that determines how primed for sleep we are is how long we've been awake. A second one that's fairly obvious, that most people would be aware of, that determines how primed we are for sleep, is how aroused we are at bedtime. And this can be, we can disturb our sleep with either positive or negative arousal. If we're very stressed and anxious, that is negatively aroused, you probably have experienced this, it's hard to get off to sleep. But also if we're excited or thrilled or, you know, in the middle of some engaging task, that makes it very difficult to get off to sleep. So low bedtime arousal is the second component that we need to get in place if we want to improve our sleep. And the third component is perhaps not so intuitive. It's something that most people in the general public aren't so aware of, but the science around sleep is very clear about. And that is the third factor that determines when we sleep and how soundly we sleep is our built-in body clock. So humans, like every species on the planet, have a body clock that's designed to predict sunrise and sunset. That's such an important event on the planet that every species has worked out we need this clock. In humans, it sits deep in the brain, about 3 inches in from where I'm pointing. And that clock actually primes us for sleep. We're not aware of the clock most of the time. And so at the end of the day, if we're falling off to sleep, we normally think it's because I'm tired. It's because I've been awake for a long time. We're not aware that the clock is also telling us it's time to go to sleep. The only time we notice the clock actually is in unusual circumstances like time zone travel with jet lag. So I can travel a long distance across many time zones, be exhausted because of the travel and the hassle of the airport and and get to the hotel, lie down in bed, think I'm going to sleep like a log, and I can't go to sleep at all. And that's because my body clock is still on the time of the place that I left. And so I'm in fact not primed for sleep by the body clock. It's about the only time we notice the body clock in action. But we do know very clearly that by getting these 3 elements organised in concert, working well together, that's how we optimise the likelihood of good quality sleep. So what does this actually mean in terms of practice, things you can do? So we're going to look at each of those 3 things in turn. You can support your body clock in a couple of ways. That is, you can strengthen that body clock signal that, you know, almost to use an analogy, you can put new batteries in your body clock. You can strengthen your body clock by making sure you get up and go to bed at around the same time every day. And by every day, I mean 7 days, not 5. That timing information feeds back to the clock, and the clock then is very clear about what time of day we are planning to go to bed. And the clock also benefits from, it's very sensitive to sunlight. And so if we can get out in sunlight first thing in the morning, maybe with a walk around the block, this is very grounding information for our body clock. But the clock is also sensitive to other factors, and the more we can stabilise key behaviours across the day, that is, important events of the day happen at around the same time every day. So important events include getting up, going to sleep, seeing sunlight, but also things like having meals, getting exercise. These are important biological events. And the more we can stabilise this routine, and so that each day is more similar, the more our body clock benefits. And just one final point about this body clock idea. It's a really important one when thinking about improving sleep, because I think, you know, if you've ever been through a phase of not sleeping well, your experience is that the problem lies when you're in bed trying to get to sleep. You think that's where the problem lies. That's in fact only a part of it. That's the arousal at bedtime component. One of the things that's really important when we're trying to improve our sleep is to be aware that sleep and wake are opposite sides of the same coin. And activity in the day actually supports rest at night, and of course vice versa. That is, the more active and engaged we are in the daytime, the more prepared and ready we are to sleep well at night. And of course, this is a virtuous cycle. The better we sleep at night, the more prepared we are to be actively engaged in the daytime. Then the second component, strengthening sleep drive. This is a no-brainer. If we're trying to sleep well at night, one of the things we have to avoid is napping in the daytime. If you're really desperate and do need a nap, say for safety reasons, then we try and do that before lunchtime, early in the day rather than later in the day, because that will interfere with sleep. Similarly, stimulants like caffeine, nicotine, we need to avoid those after midday, otherwise they will be still lingering in our system and disturb our sleep. And one of the things that's important if you are having some troubles with sleep is, irrespective of how much sleep you've got on a given night, make sure you get up around the same time in the morning, right? So you don't, as it were, earn a sleep in by having a bad night's sleep. You get up about the same time. This will increase the sleep drive appropriately. If you haven't had enough sleep one night, you should have an increased sleep drive the next day, which will facilitate you getting to sleep the next night. And finally, this little area about decreasing arousal at bedtime. There's a number of things we can do to make sure we're ready to fall asleep when we want to fall asleep. And the way I think about this is, I don't know if you've ever noticed cats. When cats are getting ready to go to sleep, they do this really cool thing. I think it's got a name, but I don't know what it is. They walk around in a circle, slowly, slowly, and they're using their claws, and it's as if they're softening the ground, or in my case, the expensive bedspread that's on my bed. That behaviour of preparing to sleep, it's them using a sort of training principle. Their body is trained to have activities that precede sleep, and humans can do the same thing. So the point of this is we can set up our evening schedule so it is telling our body that sleep is on its way. That includes decreasing stimulation of all kinds, having a sort of wind down time, which, as I say, trains sleepiness. We may need to also actively get rid of any anxiety of the day. Yeah, so if we've had a stressful day or there are things that are on our mind, we really need to deal with that well before this wind down period. So if we're going to try and problem solve, we need to do that, at 6 o'clock, 7 o'clock at the latest. We cannot be doing that at 9 or 10 o'clock, and we definitely cannot be doing that in bed. Problem solving, attempts to solve, things that are a bit difficult for you at the time, always turns into worry if you do it after dark. Yeah, it's much more beneficial if we do problem solving when we're still alert and awake, and keep that period in the evening for winding down, and definitely protect bed from that sort of activity. And you might at those times also use standard relaxation techniques. A lot of people use mindfulness type techniques for this sort of thing. If you don't have an anxiety management technique, it's time to get one. And finally, we need to do a bit of work on the bed itself. So we need to condition the bed as a cue for rest and relaxation. This is another sort of behaviourist learning theory idea, treating the human as if they're like a pet in a way. The bed needs to be associated with rest and relaxation, which means you can't be doing other things in bed. You can't be watching exciting movies. You can't be fighting with your spouse. You can't be lying in bed worrying about being awake, right? Because that is all those things would associate bed with arousal. And so the rules around this are very simple. We need to make the bed a place where the only things that happens there are sleep and sex, if that's an activity that you find calming. And we only go to bed when we're sleepy. And there's a difference between being tired and being sleepy. And if we're not asleep, if we're struggling to get to sleep for some reason, if we're going through a phase of not sleeping particularly well, after 20 minutes or so of being in bed, we get up, do something calming and not stimulating until we're sleepy again, and then return to bed. Now these are, I'm speaking very briefly about these things. There's a lot more detail about these in some of the resources that I'm going to show you. So 90% of what I've said today is you can find all over the place on the web. It's well known and there's books about it. And I'm just going to introduce you to a couple of resources that we think are particularly useful. So the first one is a sleep diary put together by colleagues of mine in Western Australia. You can find it on the web. There's the link there. And the good thing about this is it gets you to track on a daily basis your activities in the day, you know, your caffeine intake, how your evening was structured, then how you prepared for bed, what happened during the night, did you sleep well, did you have interrupted sleep when you got up. And by monitoring sleep across a number of days, you start to develop your sort of sleep expertise. I suppose I've been speaking in general terms about the relationship between behaviours and sleep, but obviously we need you as an individual to start to become an expert about how that works for you. And a sleep diary is a very good way to start to do that. Then, of course, there's now dozens of apps that you can put on your smartphone to help you monitor sleep. So we've just identified a couple of these, one for iPhone and one for Android, which are just an easy way to keep track of what happens at night. And many people find this a useful tool to go along with the sleep diary, just as a way of developing their expertise about sleep. Much of what I've said today about improving sleep is better described and in much more detail in this sleep hygiene document developed by my mates in Western Australia. And you'll find this a very clear and engaging way of going through the basic tips of improving sleep. That whole area of stuff is called sleep hygiene. And then you've probably seen lots of these things on the web. This happens to be just a pretty good one. It's got a series of tips, all of which are consistent with what I've been saying today and what are in that sleep hygiene document. And that's an interesting one to have a look at. And then finally, this is just the last thing. A lot of people with bipolar disorder actually have significant problems with their sleep. And I've been talking today about the things you can do yourself to help improve your sleep. And there's lots of evidence to show that these things are worth trying. But there is, of course, some situations our sleep gets the better of us, and we might actually have a diagnosable sleep problem like insomnia. And with many sort of psychological issues, up to a point we can manage them ourselves, and then comes a point where in fact some professional assistance might be useful. If you meet criteria for insomnia, that is, you've been struggling to get a good night's sleep for a long time and it's got into a bit of a vicious cycle, it might be time for you to get some professional assistance with that. And so one of the other resources that's useful is there's an online sleep quiz which is put together by a very reputable group of researchers using a standard instrument that's used in the sleep field. And you can complete that, get a score, and that will give you a hint whether your sleep problems are sufficiently severe that it might be worth your while having a chat to a professional about it. And that professional could be a counsellor, a psychologist, a GP. All those people know something about managing insomnia. And as I say, everything that I've been talking about today is really based on the content that we've put online in the Wellness Centre in the sleep domain, so please go and have a look there if you're at all interested. And just to say a thank you to the people who've supported this work. The development of the online site and a lot of the thinking behind these webinars was supported by a range of people, including CIHR. Thanks for listening.
Thank you, everybody. It's now time for the question and answer part of today's event. Dr. Murray, the first one that has come in asks, what are some of the challenges of shift work and how can I manage them?
Yeah, that's a really good question, and we did mention shift work just in passing in that little video. There is a real problem for people with bipolar disorder in shift work because it impacts their sleep. So people don't sleep as well in terms of the timing of their sleep. One of the things that we know about sleep is if we sleep at the wrong time, it's not as efficient for us. We don't get the same value as we do if we sleep at the time when our body clock wants us to sleep. So shift work will disturb that. But shift work also disturbs the body clock in a way that's kind of similar to jet lag. So it is quite a serious problem. We do generally encourage people with bipolar disorder not to engage in shift work if at all possible. If they do have to engage in shift work, then we would ask them to, and I do this a lot with my patients, is to get your professional to write a letter to your employer, if you're comfortable with your employer knowing about the diagnosis, requesting that the shifts you do aren't on a rotating cycle. That is, you stay on a stable shift, either morning, afternoon or evening. You don't rotate. And secondly, of those shifts that are available, morning, afternoon and evening, there's the evening, nighttime ones that we would ask that you try and avoid primarily. So morning and afternoon are probably going to be better for most people than the evening shift.
Some useful tips there, thank you. The next question states, some people I know are morning types and some are evening types. Is this relevant to the sleep problems associated with bipolar disorder? Yeah,
so this is a really important idea. It's the idea that there are strong individual differences in sleep. So we mentioned one of those in the webinar, that people have a different preferred total amount of sleep. You know, though the average is 8, some people get by very happily on 6, and some people prefer, you know, more like 9 or 10 hours. Another important individual difference that's just pretty much stable across the lifespan and it's actually got a strong genetic component is this thing called morningness, eveningness. And you'll know, you know, the people who are listening to this will know straight away whether they are more morning types or more evening types. People with bipolar disorder tend to be evening types. And this means that even outside episodes of disorder, when people are in episodes of bipolar disorder, their phase gets changed quite a bit because of the problems with sleep that go with the episodes. But outside the episodes, people with bipolar disorder tend to be evening types. Now, what's interesting about this is being an evening type has some characteristics that go with it. For example, people who are evening types tend to be more creative and open to experience, these night owl types, and sort of correspondingly, they often have trouble, or it's a bit of a challenge, working ordinary 9-to-5 schedules because it's difficult for them to get up in the morning. So this is where we often see people with bipolar disorder having a bit of a sort of schema that says, you know, we've got these people like me who are more evening types, more creative, and people who are more day types, morning types, who, you know, get up and go off to work and work 9 to 5. Now, obviously, for many people, it is important that they can get up in the morning promptly and be alert and get to a job that starts at around 9 o'clock, or get to study or school, or get the kids off to school. And that's where that idea we mentioned in the webinar becomes really important, of in the evenings encouraging your body to be ready for sleep relatively earlier. That evening wind down time that we spoke about on the webinar is particularly important for, as it were, sort of pushing back against this tendency to be an evening type. People who are evening types tend to sort of get very comfortable around 9 o'clock at night, 10 o'clock at night with what's going on, watching the telly or on the internet or doing some work or reading, and all of a sudden they find it's 1 o'clock in the morning. Now, that's going to be a problem if you have to get up at 7. So one of the things we find with people with bipolar disorder is just that they can put some very useful effort into just encouraging their body to be ready for sleep a bit earlier, and not going with this sort of increased momentum to keep going with activities into the evening, to wind that back with those sleep preparation activities we spoke about.
Interesting. Thank you for that. The questions are coming through thick and fast. This next one is two questions in one, and is really speaking about medication use and sleep. It states, Dr. Murray, a lot of us are on atypicals, benzodiazepines, and neuroleptics. Do you know, first of all, whether there are studies that suggest that these medications in themselves change the body clock over time? And then also the second part of the question is about concerns of addiction to some of these medications that help people with bipolar disorder sleep.
Great question. As a psychologist and not a psychiatrist, I have to say firstly that my expertise is not in the area of medications. But I have paid a bit of attention to this literature because of my interest in sleep. I don't know of any studies showing that long-term use of second-generation antipsychotics disturbs the body clock over time. We do know that benzodiazepines are not an ideal way to manage long-term problems with sleep. So there's a long-standing concern about benzodiazepines as not being a great way to manage sleep problems. And in terms of I'm sorry, I've forgotten the second part of your question.
The second part of the question was around concerns for addiction, particularly in relation.
Oh, yes.
Yeah. Okay.
Yeah. So I don't think we would normally be concerned about addiction in relation to the prophylactic medications that people with bipolar disorder are on. So the second-generation antipsychotics and lithium, we don't tend to see people needing to increase their dose of that just because of ongoing use. So you don't have those normal sort of addictive phenomena. That's not a term we would use. And generally speaking, research which has gone to ask people with bipolar disorder how they do use their medications to help them with their sleep, most people with bipolar disorder describe that they're quite happy with the fact that a dose of antipsychotic medication can normally get them off to sleep, even if they are becoming a bit hypomanic or even manic. So a lot of people with good sort of self-management strategies for bipolar disorder are very comfortable with the strategy of perhaps just using their normal dosage of antipsychotic medication to help them get a good night's sleep every night, but also perhaps having a spare pill for a period of time where they're starting to have trouble getting off to sleep, and in discussion with their doctor, they might just on a PRN basis just choose to increase their dosage a little bit for a couple of nights if they're finding it difficult to get to sleep. So I suppose that's a long answer, but the short answer is the evidence that I'm aware of from both the scientific literature and the qualitative interviews with people with bipolar disorder tells us that antipsychotic medication in particular tends to be a fine way for people with bipolar disorder to manage their sleep. The things we've been emphasising in this webinar augment those strategies of medication, which are, for most people with bipolar disorder is a core part of managing the disorder. These behavioural things we think are going to strengthen the benefits that already come with the sensible use of those primary pharmacological interventions.
Yeah, thank you for that. I think this question was also getting at not just the antipsychotic medications, but things like zopiclone, which isn't recommended for long-term chronic use. In addition, perhaps, to those behavioral strategies, I know in the past that I've heard you speak, Dr. Murray, on testing out your cognitive beliefs around sleep. So, for example, a belief that if I don't take this medication tonight, there's no way I'll be able to get to sleep. And I'm wondering if those might also be something that would be useful in situations like this.
Yeah, absolutely. That is a sort of an important point, Erin, that we can become kind of psychologically addicted to something that works to help us sleep, because troubles with sleep can be so distressing for people. They're like other sort of phobias or behavioural problems and especially because the problem manifests when we're tired and it's the end of the day, so people get very distressed. And so there is a strong sort of tendency to become, as it were, psychologically addicted to a pill that seems to work to get us off to sleep. And you're absolutely right, Erin, that people can benefit from exploring the extent to which they actually are dependent on that medication, or whether they could in fact take over some of the benefits of that medication and handle it through these behavioural and cognitive changes that we've been talking about in the webinar. So I suppose I keep sort of walking a fine line here. To some extent, the pharmacological treatments are extremely useful. Well, we know they're extremely useful for bipolar disorder. In terms of their impacts on sleep, there are clear benefits. For some of the medications that people are on, there are not so clear benefits, benzodiazepines being the clear example. And so we would encourage people who've been participating in this webinar to think to themselves, am I relying on a medication in a way that actually I haven't tested for myself? And I could explore what it's like to invest a bit more energy into the behavioural techniques.
Thank you. So here's an interesting question. Is there a common problem of waking up with anxiety, especially if you're waking up later in the evening or later in the night?
It's not, so yeah, that's a really interesting question. Yes, it is. It's quite. I've heard many cases where people with bipolar disorder wake with anxiety in the night, and the question is what might be causing that. So one possibility is that we're actually waking with anxiety about being awake. So there's all sorts of reasons we might wake with anxiety. There might be concerns across the day, there might be stresses at work or issues with one's bipolar disorder, etc., etc. But just to keep it sort of constrained to the topic of today, people not uncommonly wake in the night, and if they have concerns about their sleep, the first thought that crosses their mind is, oh bugger, I'm awake and this is a problem again, and so that's associated with anxiety. In fact, there's been a recent study in insomnia generally, and I'm confident this would translate to people with bipolar disorder who have sleep problems, where we noticed that one of the very interesting things about waking in the night is people who have a problem with their sleep, who self-report that I'm not getting enough sleep, their subjective estimate of how much sleep they're getting is actually quite a bit less than what we find if we objectively measure their sleep in a sleep lab. That is, people who say, I don't sleep well, tend to exaggerate how long they're awake. And a recent study has been exploring, well, why might that be? And one of the reasons that seems to be is when people, in normal sleep, we all actually wake up a lot during the night. But people who have concerns about their sleep, when they wake up in the night, they wake up kind of anxious because they've got this dominant idea, I'm not getting enough sleep. So that leads them to be aware of being awake in the night much more than people who don't experience a problem with their sleep. And they then underestimate their sleep because, in fact, they're spending chunks of the night anxious about their sleep, whereas someone who's more comfortable with their sleep cycle may have the same number of awakenings, but they don't experience them as associated with anxiety. So, long answer to your question, but the short answer is yes, it's not uncommon. And one of the things you might want to look at is if you're waking with anxiety, is that to do with unproductive and unrealistic beliefs about sleep? And so a productive and important idea about sleep is to be aware of the fact that the normal sleep cycle, the healthy sleep cycle, involves regular awakenings in the night. And if we're comfortable with those awakenings, we just go back off to sleep. If we're uncomfortable, if we think they're a sign for some concern and they make us anxious, it actually becomes a little bit harder to get back to sleep.
Useful, thank you. So here's a cardinal question that's come in next, which is asking around, let me just go back, there's a lot of questions coming through. Do you have any tips specific to teens with bipolar disorder who tend to stay up very late and then sleep until mid-afternoon? This could be asked perhaps if a teen wasn't living with bipolar disorder.
Yeah, so this is a well-known problem. In fact, the National Sleep Society in the United States has called this an epidemic. of teenage sleep deprivation caused by the fact that all teenagers experience a phase delay with puberty. That is, they become more evening types. Everyone does. This is part of the normal developmental sequence, normal developmental changes with sleep. But as I said in the webinar, people with bipolar disorder or people who are on that spectrum are already a bit prone to the evening types, so they might get a double whammy in adolescence. And if you're someone with bipolar disorder and you're experiencing that your adolescent is having this normal, well, normative, it's very common phase delay in adolescence, that would be potentially a cause for concern. So there's been a lot of research done into how we might facilitate adolescents pulling their clock back, as it were. That is, not extending their day to 1 o'clock, 2 o'clock in the morning. And a lot of this is common sense. And we mentioned some of these things already in the webinar. So activities that are arousing or engaging in the evening will tend to push the clock further, that is, delay sleep even further. There is this normal biological tendency for adolescents to want to go to sleep later. Their body clock actually delays with adolescents. But you can either go with that and push it, or kind of fight against it, try and pull the clock back a bit. And the techniques or strategies for pulling the clock back, for encouraging sleep earlier in the evening, are basically about disengaging from the activities of the daytime. Now, as we all know, that's become a lot harder with social media. So social media effectively is like the modern version of the fire in the cave when humans were developing these sleep-wake systems. Adolescents loved sitting around the fire in the cave late at night, because adolescents want to be up with each other and they want to be separated from the adults. Now, the problem with social media is it goes 24/7. And so there is a challenge for parents in suggesting to their adolescent that they, as it were, leave the fire, back away from social media by 9 or 10 o'clock at night rather than midnight or 1 o'clock in the morning. And that's a discussion that I do a lot of work with schools where we're helping parents have with their adolescents, because adolescents are aware of the costs they experience for concentration, mood regulation the next day if they have stayed up too late the night before. They're aware of that. And one of the key skills that the parent has to bring to a discussion with their adolescent is to not be judgmental about those late night behaviours. The desire to stay up late and be on social media is at least partially biologically driven. And so it's not that the teenager is being sort of slack and not organised and not being thoughtful about the costs of the next day. They have a biological tendency to go to bed too late for the school schedule that's going to hit them first thing tomorrow morning. It's not their fault. And so when we have this discussion with adolescents about withdrawing from activities and particularly social media in the evening, we need to be aware of that. It's not as if they're just being careless about the responsibilities of the next day. They have a genuine challenge. Their body clock wants them to go to sleep at around midnight. The body clock wants them to go to sleep around the same time they do on holidays. Just one final tip about this. There's a tendency for adolescents to try and catch up on their sleep on weekends. So they're sleep deprived all through the week because of study and this natural delay of the clock. Natural tendency to sleep through till midday, 1 o'clock in the afternoon on weekends. That's not okay. They are allowed to have a bit more sleep on the weekend, so maybe till 10 o'clock on Saturday and Sunday, but not midday. So what I do with my daughter is I open her door at about 10 o'clock on Saturday morning, because I know if she sleeps till midday, we've got a problem for Sunday morning, which is a very serious problem on Monday morning.
And she goes, Dad!
She does. Exactly.
We're running low on time, Greg, but maybe we can just wrap with two brief responses to a question about A, do you recommend melatonin, and B, do you recommend exercise in helping stabilize sleep?
Yes, melatonin, even though there's not much research into it yet, but people who work with melatonin are very confident that it will be useful for people with bipolar disorder, like it seems to be for people without bipolar disorder. In fact, melatonin is already included in an antidepressant medication for bipolar disorder called agomelatine, and that seems to have some specific benefits for depression in bipolar disorder. Exercise is a no-brainer. The more exercise we do in the day, as long as we don't do it too late into the evening, the better we are likely to sleep.
Wonderful. It's time to make a close to this at this point and to say thank you very much for that very rich question and answer session. There's obviously a lot of interest in this area, and a special thank you to our speaker today, Dr. Greg Murray, for joining us and providing his insights on this topic. Thank you, Greg.
Thanks, Erin. Thanks, everyone, for listening.